Alrighty guys, good to finally be back. I'm Dr. Leo Venus and today I am checking in from LA, here in California, USA. I'm actually here visiting my brother John and we have some exciting projects we are working on that I'll tell you more about later. But for now, if you're new to this channel, make sure to click the subscribe button and the notification bell next to it so that you are notified every time I make a new video. For today's video, we are going to be talking about a certain subject which was asked over at Patreon. And by the way, I recently created a Patreon account and the link to that is in the description box. And the question that was asked by one of my dear patrons was, once you become insulin dependent, can type 2 diabetes be cured or just managed? Now, before we answer this specific question, let's do a quick run through type 2 diabetes. This is how this disease has been taught to medical professionals for many years. Type 2 diabetes is a chronic condition that affects the way our body metabolizes sugar. It used to be known as adult onset diabetes, but today more children are being diagnosed with the disorder, probably due to the rise of childhood obesity. There is no cure for type 2 diabetes, but losing weight, eating well, and exercising can help manage the disease. If diet and exercise aren't enough to manage your blood sugar well, you may also need diabetes medications or insulin therapy. Type 2 diabetes develops when the body becomes resistant to insulin or when the pancreas is unable to produce enough insulin. Exactly why this happens is unknown, although genetics and environmental factors such as being overweight and inactive seem to be contributing factors. So there are a few issues with this way of viewing type 2 diabetes. Firstly, it emphasizes no cure and chronic, while there is actually ample evidence suggesting that this is a condition that can indeed be reversed. Secondly, the behavior change and the lifestyle factors that are actually mentioned here can be part of that solution in order to completely reverse this condition rather than just manage it. And thirdly, even though we might not know absolutely everything there is to know about type 2 diabetes, it is crystal clear that it is an unhealthy Western lifestyle that causes this disease rather than factors that are outside of our control, such as our genetics. The mainstream medical view of type 2 diabetes propagates an attitude of hopelessness. It causes confusion around the true cause of the disease and ultimately disempowers individuals from achieving their best possible outcomes. To me, this is especially disappointing as I know that for the majority of people, we are it. Doctors are seen as their best hope for finding their health, and in this instance, we are miserably failing. Despite the growing evidence that reversal is possible, achieving reversal is not commonly encouraged by our healthcare system. In fact, reversal is not a goal in diabetes guidelines. Specific interventions aimed at reversal all have one thing in common: they are not first-line standard of care. This is important because there is evidence suggesting that standard of care does not lead to diabetes reversal. This raises the question of whether standard of care is really the best practice. So what do we do then if we have type 2 diabetes and we want to reverse this condition in order to avoid all of the complications that are associated with it, such as eye disease, kidney failure, nerve damage, which can lead to amputations, heart attacks, or if you have pre-diabetes and you want to avoid getting the full-blown disease? Well, since this condition is caused by an unhealthy lifestyle, the natural solution is a healthy lifestyle. And one of the most important factors in a healthy lifestyle is diet. And not surprisingly, the diet that has been shown to do the best in terms of preventing and even help treating and reversing type 2 diabetes is actually a whole food, plant-based diet or a healthy vegan diet. The majority of the biggest, most well-respected health organizations in the world have the position that the optimal diet for human beings is a predominantly, or at least a predominantly plant-based diet, with, for example, the FAO standing behind this, and all of the biggest organizations of nutritional experts in the world, such as the Dietitians of Canada, British Nutrition Foundation, the Academy of Nutrition and Dietetics, pointing to the fact that a whole food plant-based diet is not only beneficial for type 2 diabetes, but also for people who are obese, for people who have high blood pressure, for people who have heart disease, and for people with certain types of cancer. Now, though food is extremely important, there are also other lifestyle factors which are important contributors to your long-term health, and you will always get better results if you incorporate a holistic approach where you are implementing all of the evidence-based lifestyle strategies in order to optimize your health, such as diet, as we talked about, but also exercise, sleep, relaxation, and social and mental well-being. There's also evidence for some success with other strategies such as bariatric surgery, such as low-calorie dieting and low-carbohydrate diets, but these are not without their own risks. Bariatric surgery comes with a mortality rate of 0.28 to 0.38% for sleeve gastrectomy and 0.35 to 0.79% for Roux-en-Y gastric bypass surgery, and complication rates as high as 13 and 21% for sleeve gastrectomy and Roux-en-Y gastric bypass respectively. Not to mention that these strategies only have evidence for short-term success, whereas most of these benefits are lost in the long term. Now, in order to answer Brenna's question about the reversibility of type 2 diabetes, it is the case that the longer you have this condition for, the more difficult it becomes to reverse it. And what happens in type 2 diabetes is that initially, with the increasing insulin resistance and the increasing visceral fat around your pancreas and your liver, your body actually compensates by increasing the production of insulin. But eventually, over time, this negative cycle will eventually lead to pancreatic failure, or failure of your beta cells, which are the cells that produce insulin in your pancreas. And when this happens, your body actually loses its ability to produce this very important hormone. And at this stage, I'm afraid it is very difficult to do anything about this. As this paper from the Lancet points out, in the Counterbalance study, none of the patients who had been diagnosed with diabetes for more than 11 years returned to non-diabetic fasting plasma glucose concentrations after lifestyle modification. This is a perfect example of prevention over cure. Now, if you watching this are someone who is worried about your own lifestyle or worried about chronic health-related issues, then that is exactly why I am here in LA right now. I decided to join forces with my brother John and his team in bringing you the best, the most complete vegan health service possible, emphasizing the holistic lifestyle factors that will help you reach your health goals and allow you to live your life to the fullest. The team is actually giving out free consultation calls right now, so if this is something that interests you, go down to the description box, click the link, and book your free call right now. Other than that, I want to say thank you so much for watching. Thank you to the patrons that are supporting my channel, and thank you, Brenna, for asking this question over at Patreon. I really appreciate it. These are issues that are affecting a huge number of people, almost 500 million people today. It's very important to talk about, and these are also issues that have a lot of confusion around them. So I'm very happy that we got to bring this up in this channel, and I look forward to seeing more of your suggestions over at Patreon. And also do let me know in the comment section what you thought, or if you have any other questions about the topic. So thank you so much for watching. Stay evidence-based and go plant-based.